Well, thanks very much, Michael, and hello to everyone. It's a delight to be here. It's almost like a homecoming for me to ISSR, and I'm delighted to see that you're really tackling the important challenges and the important issues that we're all confronting. Indeed, let me take you back about 2 years in Germany into 2018. There was a study that analyzed the digital maturity of healthcare systems. And of 17 countries, Germany came in on spot 16. The only thing good to say about this ranking is that, fortunately, there was Poland. They came in 17. So it was clear that a lot of homework needed to be done, even in 2018, if we wanted to catch up with the rest of the world with regard to digital maturity and digital technologies in German healthcare. That was the reason for founding the Health Innovation Hub, by our Minister of Health, who had just come into office. And basically, the group is comprised of 15 outside experts with very deep domain know-how in digital technologies as well as in healthcare. It's an interdisciplinary mix, so we got physicians, data scientists, pharmacists, nurses, but we also have legal experts, regulatory experts, and also entrepreneurs within our group. So we try to build a bridge between politics and what a ministry sort of tries to do, and the real world where real patients actually get treated, and try to sort of reflect those two different views, which is really quite interesting. Our main focus is really that we're sort of like an in-house think tank for the Federal Ministry of Health. Initially, when I started on this adventure, I was a little hesitant. I thought that keep their doors closed. Not so. It was really over the past couple of years, we've seen a lot of very open doors and a lot of very positive interaction. We try to scout for new ideas and then support the implementation. Of course, we do this not sort of without a purpose, but rather because we're all driven by implementing digital tools to improve healthcare for the overall population of now 85 million people in Germany. Over the last 2 years, so since 2018, there has been sort of an explosion trying to catch up with the world in regulatory legal laws. And I don't want to bore you with each detail thereof, but there really has been an unprecedented effort to really move Germany into the modern age with regard to digital technologies in healthcare. And it came, you would say, probably a little too late, but at least we did start before Corona hit us. And there was just a recent analysis where people were asked how digital technologies really helped them navigate through Corona. And much to my surprise, 52% of the people said that digital technologies really also helped them to meet the challenges in healthcare. That's a value that is higher than I expected, simply because of the fact that we had started, we were on our way, but then we were sort of overtaken by Corona. How do we react to that? And that's what I want to spend a couple of minutes on. The first thing that we did as a Health Innovation Hub is trying to sort of systemize things, and we designed a map of the Corona patient journey and tried to figure out where digital tools could actually help and support patients on that journey and support our healthcare system, quite frankly. Some of the efforts in green actually worked quite nicely. Some of them in red did not work at all. And some of them sort of were a mixed bag. In addition to that, just to organize the digital community, which we found to be larger than we'd actually anticipated, we started really putting a very strong emphasis on communication with initially daily newsletters that then went to 3 times a week. Now they're still weekly newsletters with a lot of web analysis and web presence, and then of course also with a lot of webinars. Trying to inform people of what is needed and where the healthcare system actually needed support. That actually was very well received, and through that a number of initiatives were started, like this Corona bot. Very early on, there was just a lot of demand on information. There was a lot of uncertainty, so the company designed this Corona bot, which allowed you to put in your individual risk analysis. Did you travel? Were you exposed? How did you feel? All of these were unknowns at the time, and it would come up with a value that kind of geared you towards you're at real risk of having corona versus no, you're probably safe. From there, we went on to try to support the national government to actually be a little bit ahead of the wave. And somebody had the brilliant idea of using Fitbit data. And you know, if you're sick, your heart rate goes up and your activity level goes down. Those are actually measured, and we were able to actually find more than 500,000 participants in a very short amount of time who donated their data so that the regional hotspots could actually be recognized early on. And that was really the first phase of the disease where these data was, you know, the measurement of data and the testing facilities, all of that was, you know, not as well developed, of course, as it is now. A number of companies really stepped up to the plate by digitizing their offering, you know, therapies for patients with stutter, online birth preparation courses, all kinds of support for patients with psychosocial problems, which, by the way, increased dramatically on a national level over the past 16 months. As well as e-health solutions for caregiving relatives. These are just 4 examples of just a plethora of different sort of initiatives that were started and then made available to the general population. Most of them, by the way, free of charge initially. Eventually, sort of these companies decided to make a business model thereof. A big national effort was the creation of the Corona Warn app, which basically you could download on your smartphone. And if your smartphone was where you were, it would actually see if we were close to somebody who turned out to have the disease. And this was trying to bridge the time that we know, the incubation time where patients actually don't have symptoms. And this Corona Warn app has now been expanded in its functionality to also carry rapid test results, et cetera. And just the numbers on the warn on the app. 30 million downloads is really quite a number. It's probably the most successful app that there is in Germany right now. Video consultations really took off. We had 1,500 physicians out of a total of 180,000 ambulatory care physicians in Germany who offered these services in January 2020. By June 2020, it was 130,000 physicians who offered video consultations. And it's interesting, the feedback was very, very positive, both from patients and from physicians. So a lot of this is going to actually last beyond Corona. Home monitoring was quickly developed by some very good and able PMS and HIS providers. The challenge here, of course, patients in quarantine who couldn't be taken care of needed to be monitored with PO2 sensors as well as heart rate and, of course, temperature sensors. And then hospitals really stepped to the plate by providing transparency with regard to their resources. Very early on, the interventionalists actually created a registry called the DIVI registry, and every hospital now by law is required every day to actually put in the number of beds that they have in ICU that are available. And you can see through coloring, it made it easy to manage patients, and if there was a hotspot in one area, other areas or other hospitals could step in and take the load. Also, interesting, very quickly, hospitals started doing a tele-ICU or offered tele-ICU. The Charité in Berlin, as well as the University Medical Center of Aachen, were really the leads here. They did a lot of, and a lot of others sort of started copying this. Legal issues that seemed unsolvable, like how do you deal with data privacy if you have 2 institutions involved? How do you deal with the liability issues? All of that could be solved within a week's time. It was great to get these things sort of behind us, and a lot of effort sort of went into that and making it work. Now, what did not work was our public health service system. They worked very well. We have 163 disjuncted, not organized public health services throughout Germany. Unfortunately, they were not connected through a single IT tool. They had planned to have this tool for the last 10 years, but nobody decided to actually implement it. So they really had to communicate with fax, which made it difficult to get a proper overview of where we stood in this pandemic. You know, it was very fragmented. even today, the government decided that one of the software, SORMAS, was going to be sort of the standard, and even today, only about 80% of these local health service organizations use this sort of software, and this is 16 months into the pandemic, and it just shows that it's really hard to get people on the same standard. Maybe it's the wrong sort of approach, and so we sort of stepped in and developed what we call COCOS, which is international standards in Germany on Corona component standards, trying to at least give them the same language by which they start interacting, even if they have different systems. And that is based on 3 pillars: medical domain expertise, uniform naming, and of course, FHIR profiles from a data format point of view. That actually is beginning to take hold and is the basis for a lot of research that's being done. Also, first, all 36 German university medical centers came together in a effort which is really amazing, and started to pool their research results and data to make it more meaningful to look at larger data analysis. And here, particularly the radiologists are very much ahead of the pack. Again, you would say by doing this project called Raccoon, where they have actually managed to bring in all radiology data together. Now, what worked, what didn't? I think there is light and shadow. We were surprised by how much willingness there was of the general population to support, how much willingness there was of industry, of small startup companies on all levels, really to support the effort. Everybody stood up came up and really tried to be very helpful. Telemedicine really worked. The Corona Warn app is better than its reputation. I think it did a great job, considering it was the first time we did such a thing. And then, there were also a number of things that did not work. I mentioned the public health services, the lack of interoperability. We never got around to having a proper scheduling software for testing as well as for vaccinations. It's still a problem. We still don't have a digital vaccination document that is in the process of being developed. We could have done that a year ago. A number of shortcomings. What did we learn? We want to get faster with regard to the digital transformation of the German healthcare system based on interoperability. I think that's the central lesson from Corona, that we need commonality in data formats, in semantics and syntactics. So a lot of effort has gone into that, and then we're really driving the national electronic healthcare record system, which started at the beginning of this year. The digital prescription initiatives are taking up, and they're starting in July right now, next month. And then we were actually the first in Germany worldwide to implement apps as part of normal healthcare, of the normal healthcare system, so-called DIGAs. And there's now 15 apps that can be downloaded, that can be prescribed by GPs to their patients, fully reimbursed as part of the overall system. And finally, a lot of money went into the digital transformation of hospitals, 4.3 billion euros, with 10 very well-defined digital areas where hospitals need to sort of beef up their performance over the next couple of years. That's in a quick rundown what worked and what didn't. It's been a very challenging time. It's really shown a number of shortcomings, as I said, particularly with regard to interoperability of those areas that were not organized in a hierarchical sense. The focus here really, and there are a number of others that could be also examples that could also be mentioned, really are the local health services, where we all wish we would have worked harder before the pandemic to make them just a little bit more performant and really make things easier for everyone. With that, thank you very much for the opportunity to present these experiences. Do get vaccinated in case you're not, and then all do stay healthy. Thank you very much.